Good afternoon. Across Canada, there have been over 19,000 cases of COVID-19 and at least 435 deaths. There are no new positive cases to announce today for P.E.I. And as you know, we had 3 positive cases yesterday, giving P.E.I. a total of 25 cases. 17 are considered recovered. We received an additional 86 negative tests back last night. And in follow-up to one of the questions from yesterday, our tests per 1 million population for P.E.I. are actually slightly above the Canadian average, and that's really due to the increased testing that has occurred over the last week or so. Yesterday, late in the day, we announced the 25th case, and it was our first case linked to interprovincial travel. And just to be clear, the interprovincial travel means someone who has traveled from one of our other provinces into P.E.I. The individual is a man in his 50s from Queens County, and he is at home doing well. And as with our other cases in the last 1 or 2 weeks, we are making it publicly available regarding age range, county, gender, status of symptoms, whether they're hospitalized, as well as if it's been interprovincial or out-of-country travel. Flight information, if it's involved, is always posted. This is an example yesterday of why we are trying to get that message out. So important to self-isolate after travel outside of P.E.I., whether it's international or interprovincial. We know there is community transmission in almost all parts of this country. And for those who are not self-isolating, practicing physical distancing and good hand washing is key. It's also a good time to remind Islanders that if you're experiencing any symptoms of COVID-19, cough, difficulty breathing, fever, fatigue, headache, body aches, sore throat, runny nose, please consider coming in and being tested. It's important for our whole community to be able to identify cases so that we can contain spread and also assist you if you need. And it is, again, a reminder that the testing is for all Islanders who may be experiencing symptoms, not just those who have traveled. And the referral for the testing can be done through your family physician or nurse practitioner or through 811. And while you are awaiting test results, it's important that you self-isolate. Yesterday, another individual was charged for failing to self-isolate under the public health order. And the individual was charged with a summary offense ticket, which carries a fine of $1,000. We've had a number of cars that have turned around at Confederation Bridge, and we continue to screen everyone arriving at the bridge and at the airport in terms of their health, what their plan is for self-isolation, and we are following them up and making over 1,000 calls a day, and that number increases every day right now so that we can follow them for a 14-day period. As we go into the long weekend, I think there have been concerns about physical distancing in provincial parks and in public spaces, and our ground search and rescue will be helping by having a presence in our parks and our public places over the weekend to remind people about physical distancing. I know when we see snow on the way, and that even in the forecast or a long weekend, many Islanders want to prepare and head out to the store, and it looks like we may have both this weekend. However, this isn't just another long weekend with a snowy forecast. We are still amid the COVID-19 serious situation, and it was a month ago today that a pandemic was declared. I would like to caution everyone to avoid crowding in lineups or outside or inside stores, it's extremely important to practice our physical distancing when in public. I know a number of the other provinces and our federal government earlier today have released modeling projections about COVID-19, and we anticipate doing the same in the days ahead for P.E.I. And not only will we be releasing it, but we will continue to update those models as the pandemic evolves here in Prince Edward Island. As we go into this long weekend, I'd like to stress again how important it is that we continue to follow these public health measures. I've said it before, and I'll continue to say it. These are the measures that may help protect our community, our families, and our system in the weeks ahead. You should not be visiting people you do not live with, and staying at home as much as possible is still so important. And I know this weekend traditionally has meant big gatherings and family get-togethers, and this year it won't be the same. But it doesn't mean you cannot connect with your loved ones and make it a special occasion in a different way. I'd like to end by thanking Islanders again for their compliance with our public health measures. It is hard, it is challenging every day to live differently. But by doing this, you are doing your part to help protect yourself, your loved ones, and our entire island community. And I'd like to also express our gratitude on behalf of all Islanders for essential workers right across the board in the province who are continuing to work so hard every day. And there are too many groups to mention individually, but they range from foster parents to social workers to our communications staff. We all experience worry and stress over the ever-evolving COVID-19 situation. And I know it's not always easy for these people in these different areas to continue to go to work. So we can help our essential workers by trying to stay home, and when we go out, practicing physical distancing. Let's continue to show kindness, respect, and appreciation, and look after one another. Thank you. Et puis en français, bonjour. Au Canada, il y a plus de 19 000 cas de COVID-19 et plus de 430 morts. Nous n'avons pas de nouveaux cas aujourd'hui à l'île, et nous avons toutefois reçu les résultats de 86 tests et ils sont tous négatifs. Il y en a encore le 25 cas en total positifs ici à l'île du Prince-Édouard. Hier, j'ai annoncé le 25e cas de COVID-19 pour la province et c'est le premier cas relié au voyage entre provinces. Il est à la maison et il va bien. Nous travaillons à faire les suivis avec les gens avec qui il était en contact. Et c'est un autre exemple de pourquoi l'auto-isolement après n'importe quel voyage est important, si c'est entre provinces ou hors du pays. Et je vous rappelle que si vous n'êtes pas en isolement, vous respectez les consignes de distance sociale et les mesures d'hygiène. Et je voulais aussi mentionner, si vous présentez des symptômes de COVID-19, la toux, les difficultés respiratoires, de la fièvre, de la fatigue, des maux de corps, même mal à la tête, vous devez être testé. Les tests de dépistage, c'est pour tout le monde qui présente ces symptômes, pas juste pour ceux qui reviennent du voyage. Les agents de 811 peuvent vous aider pour avoir les tests ou les médecins de famille. Et lorsque vous attendez vos résultats, n'oubliez pas de rester en isolement. Hier, une autre personne a reçu une contravention pour avoir négligé son obligation d'auto-isolement. C'est Pâques en fin de semaine et c'est impératif que tout le monde respecte les consignes de santé. dont je vous parle tous les jours. Si vous n'habitez pas avec la personne, ce n'est pas le temps de les rendre visite ou de recevoir. Restons chez nous autant que possible et c'est important. Et chaque jour, je vous remercie. Merci à tous les insulaires pour votre collaboration. Vous faites votre part pour nous, vos proches et notre communauté insulaire. Et au nom de tous les insulaires, j'aimerais reconnaître tous les travailleurs essentiels à travers la province qui continuent à bosser à tous les jours. Et je sais que ce n'est pas facile. Il y a des soucis et du stress pour tout le monde. Et que ça ne doit pas être facile de les mettre de côté lorsque vous allez travailler en particulier. Soyons sympas, respectueux et démontrons notre reconnaissance en prenant soin des uns et des autres. Merci. Marion.
Good afternoon. I first want to thank all the people in our health system, as well as our partners and collaborators who will be continuing to work all weekend as this response continues. Other essential workers will continue to support our island as well over the coming days. We've asked a lot of everyone, and we have seen a tremendous response, so thank you all once again. The cough and fever clinics and drive-through testing clinics continue to run 7 days a week in both Charlottetown and Summerside. And appointments, I would encourage you as well as Dr. Morrison has to please call 811 if you are needing to be assessed or need to be tested with symptoms for COVID-19. When you arrive at the clinics, please remain in your vehicle until you're notified by staff to come in. That allows us to make sure that physical distancing is happening and the process is safe for our staff and for the patients coming. The assessment clinics are also still providing an option for telephone assessments if necessary. I also want to remind everyone that as part of our province's COVID-19 response, our mental health and addiction services are providing care to patients needing acute mental health services away from the emergency departments to a new psychiatric urgent care clinic, which is temporarily located at Hillsborough Hospital. Those individuals who require emergency medical help will still be seen in emergency departments as usual, and there's a triage process in place at the emergency department, the urgent care clinic, and in the community to direct patients to the most appropriate place. Mental health professionals are available as part of a multidisciplinary team and are at that clinic. I spoke about this yesterday as well, and I'd like to mention it again, that patients who have ongoing health concerns should see your primary care provider, such as your family doctor or nurse practitioner. They are still able to see patients either in person or in some cases through the telephone, and those with chronic conditions still require care. And although we're following Dr. Morrison's guidance and ensuring we follow social distancing, remember that receiving follow-up care for these conditions is important. Reminder to call ahead to your care provider to make sure the appointments are in place or receive any instructions. I hope everyone enjoys the Easter weekend and making different memories to your friends. And my young kids were very happy to hear that the Easter Bunny will still be coming this weekend. But I do see more vehicles on the road today than I did yesterday, and just want to say that for our health system, for each other, please stay home. Please only go out for essential services to protect those workers as well as our health system. Thank you.
Oh, happy to take questions.
Brittany, CBC.
Hi, my question is for Dr. Morrison, and it's about restaurants that are still providing takeout and delivery services. My question is, what is the province doing to ensure these businesses know and are following public health recommendations to keep customers and also the employees that work there safe?
So, hi, the environmental health officers under the regulations really are trying to make sure that if there's any concerns, they follow up with any concerns from any of the restaurants who are providing the pickup or delivery. But there's also been information that's been distributed through the Restaurant Association, for instance, and there's guidance on the website as well for that particular group of restaurants. So it's everyone's learning how to do things a little differently, and not only do it differently, but to try to make sure that we do it safely for the staff in those restaurants as well as the public.
Okay, and my second question is about people being screened at the airport. But I'm wondering, why don't we have a system in place for people who arrive at the airport to ensure they self-isolate, which could include sending them directly to a hotel or another location to self-isolate? You mentioned that you had made, or the public health office had made 1,000 calls to people to check on them, people who have arrived in the province. So does that mean that we have 1,000 islanders in isolation who have entered the province?
So the screening at the airport actually involves they have to identify the plan of where they're going immediately to self-isolate and who their support person is that will help them in self-isolation. Some people have actually pre-arranged their groceries to have already been delivered, for instance, and the plan is that they go straight to their house and they have someone who will continue to drop off food for them, for instance. And each one of those people is being followed. So those 1,000+ calls are the calls that we instituted over the last number of days, and they will be followed every day for 14 days.
Nicole Williams, BBC.
Hi there. This question is for Dr. Morrison. I'm wondering what more you can tell us about the latest case related to interprovincial travel, like where they were traveling from, when did they arrive, did they self-isolate right away, when was his test done, is he from here, and if they're an essential worker.
So lots of questions in there. So I think I tried to outline what we do usually release about a case. And certainly if I was to come out and talk about 50 cases, it would be different than trying to get a lot of details about individual cases. The case arrived in the latter part of March back to the province, and at that time when they came back, the direction at that time was to self-monitor and physical distance, which they did, and then once developed symptoms and was tested, self-isolated since that time, and was not was not an essential worker going to work. So I think we've given quite a bit of other information out, and I think to respect the privacy of that individual, we really have been trying to keep the criteria of what we're giving out that way.
Okay, I just want to be clear, this person did not self-isolate right away when they came home, so I'm just wondering where they may have gone to once they came back here.
So every person that they may have had contact with, which is very limited, is being followed up and tested.
Can you clarify though? Did they go to any public spaces though, where they may have come into contact with other public people, like a grocery store? You don't have to be too specific for privacy reasons, but can you just clarify where they may have gone to?
No, they went to a relative's house, for instance.
Okay, thank you. And then my second question is, why aren't we doing more tests locally here now? Do we have a manpower issue, or is it more so that we don't have enough tests? And if it's the latter, how do we get more tests?
Well, actually, I think we, and maybe I wasn't clear, we actually have been doing more testing over the last week and a half, because we have expanded our testing criteria. So we have capacity to do more as well, and we actually even before some of the other provinces have broadened our criteria to include testing for non-travel related out of province and out of country. So since we've done that, we've actually broadened it in terms of not just cough and fever, for instance, but a range of symptoms, even mild symptoms, as well as broadening it to those who aren't traveling. So we've done more testing, and our testing per capita has increased in the last week.
Thank you.
Rachel, Eastern Graphic.
Hi. Last week, I was told there were 26 ventilators arriving to P.E.I. from the National Emergency Strategic Stockpile. I'm just wondering if you can confirm, have those arrived?
Hi. Yes, I can speak about that. Last week, we did have a verbal offer of 26 ventilators from the National Emergency Strategic Stockpile, and we've been getting updates from them this week on when some of those may arrive. And what we're understanding now is the federal government is really prioritizing the allocation of some of those ventilators to areas where there are a significant number of hospitalized patients. And thanks to our public health measures here, so far we have not seen that. So I don't have a confirmed date on when some of those ventilators may arrive, but none of them from that request or offer of assistance have arrived yet. But of course, we haven't been in need either.
Okay. And I guess along the same lines, there are some stories out right now about local companies manufacturing different supplies, and we're creating lots of bed space. I guess I'm curious, how would you describe your confidence at this point about being able to handle, let's say, like a steep increase in cases that, for instance, need hospitalization?
I'm feeling pretty confident with the current situation and the preparations that have happened. So we've been able to achieve 50% capacity rates at both of our large facilities. So that means we have half the number of patients that we can manage under normal operations at both the Queen Elizabeth and Prince County hospitals. So that gives us a lot of space to manage hospitalizations of patients. Beyond that, we've looked at preparations for intensive care, hospitalization needs, or critical care needs for those patients with COVID-19. And we have the capacity to grow from our normal sort of mid-teens number of intensive care bed spaces to upwards of 40 bed spaces if that were to be necessary. So we have good plans in place. We've implemented the preparations to be ready if that surge comes. And right now, we're fortunate enough to have that capacity should we need it.
Okay, thanks.
Stu Neepy, The Guardian.
Hi, happy Thursday to you both. First question for Ms. Dowling. I guess on the National Emergency Strategic Stockpile, wonder if you can tell me first where the ventilators were prioritized to, like which province, and also if we have received the full order of personal protective equipment that was due in last weekend, and if we haven't, has it gone to another province, and which one?
Hi. I don't know where the ventilators have gone or if they have even sent any or distributed any, but I think it's been more the message to us is that we haven't received ours because they are now monitoring the situation of others that they have ordered into their strategic stockpile from other countries and have a certain number on hand and want to be able to respond to those other provinces in Canada who may be in need. So I don't know if they've sent any anywhere else either, so I can't answer that. With respect to the supplies, though, we have received our supplies, and I know we received another order today to maintain our Nest Mini Clinic supplies, and they have been restocking us in order to continue to run that cough and fever clinic on a weekly basis. And we received everything that we had asked for, as far as I'm aware, on top of which they did provide additional supplies from that strategic stockpile to us for other personal protective equipment or supplies that we were in short supply of. So things like some gloves, some different types of masks, and other things that we had put forward a request for assistance from the stockpile for. I don't have specific numbers for you, but we can provide that if you want to request some further details from Samantha.
Okay, and I guess a follow-up for Dr. Morrison. So yesterday we talked a little bit about a shipment of, I believe, 180 kits that have come in for the local diagnostic lab for processing testing results. How confident are you going forward of receiving sort of regular supply for the machinery that we do and will have? And have supply concerns changed how much capacity we'll have to process results over the coming weeks?
Hi, Stu. So I have not heard of any concerns regarding the supply of the testing kits for the local testing. I do know that we have also increased capacity and assistance from our neighboring provinces as well, so that will help in terms of the overall testing as well, of course, as our National Microbiology Lab. So I'm actually feeling much more confident about our testing going forward in terms of capacity and ability to process the test both locally and with assistance, thankfully with thanks to our neighboring provinces as well as to the NML, the National Microbiology Lab.
Okay, thanks much.
Carrie Wynn, Ocean 100.
Good afternoon, ladies. I just have a question focusing on some of the essential services, particularly with construction. I know on the government website it has construction under there just as a subsection of repair services. We're getting a lot of calls and messages from a lot of trades workers, others in neighborhoods that are noticing construction things that are happening that they feel should not be, even some new home buildings starting this week. Can you just give us some clarification on what exactly the construction essential services would be?
So I think the construction industry has been really, really tough. We've tried to outline it here before, and we continue, as you mentioned, Carrie Wynn, to get questions on it. The intention is to try to protect certainly the staff, but also make sure that certain things that need to happen in terms of our infrastructure that's critical for our government services and health services to run if that needs to happen. I know there are no new building permits being issued. And it is a concern, I think, that we've brought forward that it's a challenging area for sure because physical distancing is difficult. So I can certainly say what we've said before here, and we're trying to follow up on concerns that we've received through the 1-800 line about this. And it is also something we've talked about with other members of the government.
Thank you. I know it's mostly tradespeople that I've heard from, and they're saying that basically the companies and the jobs they're doing are not essential, and they're not anywhere from being completed, till 6 or 12 months down the road. And some of the bigger construction companies have just simply said, it's business as usual, get back to work. We're under the essential services. But of course, they have incredible concerns, not only for themselves, but for their families, and trying to do their part to flatten the curve. And, another issue was that if they're deemed essential services, they're actually taking away some of those emergency daycare spots for essential services. So what should these people do?
And I I will say it again because I think we have said it here. Those construction projects that can be safely stopped and postponed should be. And just like many of us are having to change what we're doing and how we're doing it for the reasons you described, Carrie Wynn, that is the direction here. So I think it continues to be a messaging challenge, and we'll continue to have that discussion and follow up with concerns.
Thanks so much.
Laurent Lavoie.
Oui, bonjour. J'ai une question pour le docteur Morrison. Vous avez évoqué tout à l'heure les symptômes qui peuvent toucher les personnes, la toux, la fièvre, des difficultés à respirer. Est-ce que à Lille, parmi les 25 personnes malades, est-ce qu'il y a eu aussi des pertes du goût et de l'odorat signalées chez certaines personnes? Parce que dans d'autres pays, on entend dire que ce serait aussi des symptômes de la COVID-19.
C'est intéressant, Laurent, qu'il y en a plusieurs pays au monde qui mentionnent cet symptôme. Il ne peut pas sentir ou pas goûter à la même avec comme un symptôme de COVID-19. Et il y en a ici qui ont eu la même sorte de symptômes. Ça n'arrive pas toute seule. C'est avec les autres symptômes, souvent avec ils sont fatigués, ils ont une fièvre, tous, mais ils mentionnent cet symptôme qui est... il y a nombreuses personnes, comme vous avez mentionné, partout au pays, mais il y en a aussi à l'île du Prince-Édouard qui ont eu cet symptôme. Laurent, juste, je vais peut-être traduire ça avant que j'oublie. The question was around, I mentioned different symptoms to go with COVID-19. And one of the symptoms that is reported globally and across the country is a loss of taste and smell. And that it usually doesn't happen just on its own. It's with some of the other symptoms, or they may have a cough and loss of taste or smell, or chills, some other symptom. But it is a symptom that we've had a number of our cases here also mention.
Et juste un follow-up toujours sur les symptômes et les tests. Vous dites aux gens de venir dès qu'ils ont des symptômes. Je ne suis pas sûre que vous l'ayez dit en français, quelle est la capacité de test aujourd'hui à Lille? Est-ce que vous pouvez tester tout le monde ou est-ce qu'il y a une limite?
Vraiment, on n'a pas même... on a les tests, les cliniques, ils les testent chaque jour, 7 jours par semaine. On voit peut-être hier, le jour d'avant-hier, peut-être quelques moins que la semaine passée. Alors, on n'a jamais... on n'a pas vraiment une limite parce qu'on a toujours assez de place pour assez de tests pour les insulaires à ce moment.
Merci.
François, Radio-Canada.
Bonjour, Dr. Morrison. Le troisième cas que vous avez annoncé hier, celui qui est lié à un déplacement interprovincial, est-ce qu'un cas comme celui-là peut augmenter le risque d'une transmission communautaire à l'île? Et si oui, comment?
Alors, le cas interprovincial peut augmenter le risque s'il ne fait pas auto-isolement. Et c'est pourquoi on donne les instructions maintenant depuis, je pense, 2 semaines à peu près au pont et à l'aéroport. Alors, on va continuer à faire ça pour cette raison, parce que les autres provinces voient beaucoup de transmissions communautaires. Alors, le cas d'hier, pour moi, veut que je vraiment insiste que tout le monde qui retourne dehors du province fait tout ce qu'il peut pour s'auto-isoler.
On a appris aussi au cours des dernières heures que le ministre de la Santé, M. Aylward, ne s'était pas isolé tout de suite en rentrant dans la province lorsqu'il est rentré d'un voyage à l'étranger. Il faut dire qu'il y avait un peu de confusion à savoir quelles étaient les directives à ce moment-là. Un comportement comme celui-là, pour vous, qu'est-ce que ça peut vouloir dire?
Je pense que j'ai entendu les nouvelles hier soir. C'était la première fois que j'ai entendu. Et je pense que c'était peut-être c'était vraiment tôt dans les directions et peut-être il n'était pas seul de vraiment comprendre qu'est-ce que s'auto-isoler veut dire. Mais c'est pour cette raison, je pense que depuis plusieurs semaines qu'on donne l'information à l'aéroport et au pont de qu'est-ce que c'est l'auto-isolement. C'est important que les gens comprennent que ça ne veut pas dire aller au supermarché. Alors, je pense qu'on donne des directions qui sont plus claires. Et puis, c'est normal. Beaucoup a changé tellement vite depuis le dernier mois. So the last two questions, one was around Minister Aylward, who had, it was in the news, and I just said I heard about Minister Aylward in the news myself yesterday, so I did not know ahead of time, and I think the directions around self-isolation continue to be made more and more clear. I think that's why we're meeting people at the bridge and have been for the last couple of weeks and at the airport to make sure people understand what it means, and because people do want to do the right thing, and it's important they understand what they need to do. Remember the question before that. It was to do with the tests and our capacity for testing here, I think, and I had responded to most of that in English prior.
Julien, Radio-Canada.
Oui, bonjour, Dr Morrison. Nous arrivons à une longue fin de semaine. Vous l'avez dit, certainement que peut-être les insulaires vont vouloir profiter de cette longue fin de semaine pour sortir, faire des balades à la plage, dans les parcs provinciaux. Pouvez-vous nous expliquer en français concrètement qu'est-ce que vous allez faire pour vous assurer que les insulaires respectent la distanciation sociale dans les parcs provinciaux à travers l'île du Prince-Édouard? Et est-ce que c'est possible, selon vous, de distribuer des amendes aux personnes dans ces parcs provinciaux qui ne respectent pas la distanciation sociale?
Alors, on va, avec l'aide, et je ne sais pas comment vous dites ça en français, mais c'est Ground Search and Rescue. Les gens vont nous aider d'avoir une présence dans les parcs et les situations plus publiques pour s'assurer que les gens gardent la distance physique. Et j'imagine que c'est une façon d'éducation. Et puis, s'il y a un problème, c'est de mass gatherings, est-ce s'il envoie les gens qui voir un grand pique-nique, ils sont tous ensemble, ils peuvent appeler d'autres gens pour pour les aider, donc comme un enforcement, à enforcer ces choses comme ça. Mais c'est plutôt d'avoir une présence éducation et s'assurer que les gens gardent la distance physique.
Donc, pas de moment.
Pardon?
Pas d'amende. Vous n'allez pas des fines aux personnes dans les parcs qui ne respectent pas la distanciation sociale.
J'espère que non. Je pense que les gens veulent respecter cette direction et je sais qu'on utilise l'enforcement pour d'autres choses comme de s'auto-isoler. Et la plupart des gens, on oublie que la plupart des gens, la majorité des gens, ils suivent la direction. Et puis, 95 au moins % les gens suivent la direction et on veut éduquer les seuls qui ne font pas. Et c'est l'autorité qui est balancée, je pense, qui est important. The question was about, as I mentioned earlier, getting help from ground search and rescue for the weekend in public parks and in public spaces, which we really will appreciate. But it's 95% of people are doing exactly the right thing, and they want to do the right thing in keeping social distancing. And so it's an education role. It's a reminder, and it's not meant to be really punitive. It's really about those who may need to be reminded will have that chance with Ground Search and Rescue to help us. Obviously, if they saw, for instance, a mass gathering of where there are people grouped together for a big picnic, they would be able to call enforcement for assistance. So, anyway, thank you very much. Merci beaucoup.